I'm Dr. Scott Brown, board-certified chiropractic neurologist. Pain, fibromyalgia. What is the difference between the two? Well, we all have pain, but not all of us have pain all the time. And not all of us have pain as a result of treatment that should actually decrease pain. But our sufferers who have fibromyalgia know what I'm talking about. The very things that should make you feel better, a massage, an acupuncture treatment, a chiropractic adjustment, they help other people, they feel better. But in your case, it doesn't work that way. So what's going on? Well, let's just talk about the pain generators in general. What are some things that can generate pain? Well, you can have peripheral tissue damage. You can have what's called inflammatory chemistry in your body. You can have something called sensitization, where if you have pain for a long enough period of time, the body becomes sensitized to it and it just keeps going. You can have pain as a result of pushing your body so far that the normal aerobic mechanisms cannot get enough oxygen into the system, and the body has to go to a reserve system of producing energy, and then it leaves that lactic acid in the muscle, so that when you do something rigorous that you haven't done for years, and 2 days later your muscles are sore, that kind of thing. Then there's something called deafferentation, which is where the information from gravity can't get up through your joints and muscle spindles, which really fire 80% of your brain function. So that's a really big cause of pain degeneration, or of pain generation. Then you can have what's called a disinhibition of the normal inhibitory pathways. And normally, pain should be inhibited. You should not be suffering unless there's a direct threat to your tissue. And then there's something called cortical slowing, which is your brain is actually slowed down, so the normal mechanisms of the brain that actually send messages to your body to turn off pain, they don't do that as well anymore. So, what are some things that happen with pain? Well, the sympathetic system, which is your fight or flight system, is usually in overdrive. And when the sympathetic system is driving, what that means is that pain fibers are being generated. When you have an increase in carbon dioxide levels in your brain, that also can increase pain levels. And as we talked about anaerobic activities, where if you don't get enough oxygen, then your cells have to drive through ancillary pathways that produce pain. But you can also have a decrease in cortical frequency of firing, a decreased ability for the large diameter fibers to drive to your brain. And you can also have something called a decrease in epinephrine and serotonin, which is neurotransmitters that allow you to feel good, especially serotonin. Now, tissue is going to heal unless other neurological and mechanical factors are compromising the systems. And the longer something hurts, the longer the tissue damage is there, the more likely there is to occur something called wind-ups, like a clock. You can wind up the pain mechanisms, and then even after the stimulus is gone, the pain is there and continues to stay there. Another thing that we have to train psychologically our patients on is to not keep your mind on the pain, because dwelling on the pain actually increases the sympathetic system too, which also increases pain and inflammation. And then there's also less production of serotonin, so you don't feel good and you're unhappy about it at the same time. Pain is a perception, much like a personality, like food or music. It's not an indicator of health, and so you can't judge how healthy you are by whether or not you have pain. And pain is also not necessarily generated where your brain perceives it. So you could fall and hit your head and end up with knee pain, or you could injure your knee and have back pain, and any number of other things that go along with it. Now, what are the treatments for pain conditions in general? Well, typically, we want to decrease the output of the sympathetic system. That decreases the pain and suffering. We also want to increase what's called extensor tone. So the muscles that hold our body up against gravity, as we get older or injure ourselves, begin to fail and we begin to droop. When we do that, it means the output of these muscles to our brain has been lessened, and as the brain lessens its output, it then fails to inhibit pain throughout the body. We need to increase an area of the brain called the lower brain stem, which is inhibitory to the sympathetic system, and we need to decrease the activity of the upper brainstem, which actually stimulates the sympathetic and the pain systems. We need to stimulate parts of the body that will make you appreciate all the sensory information coming from different parts of your body. So if you have a loss of vibration sense on one side or a loss of pain sensation, we need to equalize that and do things to make the brain be able to appreciate all those things. We need to increase muscle spindle and joint activity, increase blood oxygen and pH, strengthen joints and muscles, and decrease stress. The key for this with our fibromyalgia patients is that a lot of these things that we want to do to inhibit pain, you can't do because they actually cause more pain. So we have to look at the blood work. We have to look at all systems in your body. We have to do a thorough neurological exam, and we have to realize that with these special patients that we have to actually go a little bit slower. We need to take care of your blood chemistry. We need to take care of what you eat and how you exercise. And only after the brain is working better and these plasticized pathways have been slowed down can we then begin to do some of the things that help normal people. This is a particular area of interest of mine. I've treated a lot of fibromyalgia patients, and it's not going to be accomplished with the typical go here, do this, take that, get a treatment, do this. It's just, it doesn't work that way. So if you are serious about looking at all systems in your body, neurotransmitter assessment, metabolic assessment, neurological exam, and if you want a thorough evaluation, then I think that it's possible that someone like myself can help you. Now you can call our office and one of my team will put you on the phone with me and I can discuss for a few minutes with you and see if you fit our model. It's not for everybody. Certainly not for somebody who's looking for a quick fix. There are less than 1,000 of us worldwide who are board certified in this type of treatment. So if you're not local, I can find somebody close by. If you are in the Lakewood, Denver area, then you can get on our waiting list, and I would love to see if I can help you. So I wish you the best of health, and if I can be of any help, please let me know. My website is www.browncnc.com. Thank you.